So we would define erectile dysfunction as the inability to achieve and maintain an erection that's satisfactory for sexual intercourse. This would include issues such as premature ejaculation, diminished libido, or even curvature of the erection. Erectile dysfunction can be caused by a number of different factors. Most people would think of general medical problems like high blood pressure, high cholesterol. Diabetes has a very profound impact on erectile function. But other things that we think about are medications such as antidepressants, blood pressure medications, traumatic accidents that could affect the spinal cord, the penis, hormone issues such as low testosterone, diminished thyroid function can all be risk factors for erectile dysfunction. There can also be a psychogenic component to erectile dysfunction. I would usually tell guys that erections are 20% mechanics and probably 80% brain. And the mind component cannot be underestimated in terms of sexual function and erectile function. We can see young men, even in their 20s, that will have performance issues, erectile issues, and a lot of this may stem from depression, anxiety, antidepressant medications that are used to treat these disorders, marital issues, relationship problems, and all these things have a profound impact in the quality of their erections and their sex life. Our treatment would be sort of directed at whatever the root cause is. We like to try to look at the patient's overall health, replacing low testosterone, correcting any endocrine abnormalities, optimizing overall health issues such as high blood sugars, high blood pressure, reviewing medicines that may be responsible for a portion of their erectile dysfunction. All of these things are non-surgical approaches to try to help improve erectile function. But we could also add medications that will help augment sort of the mechanics of the erection. These are oral medicines such as Viagra or sildenafil, tadalafil, Cialis. Injectable medicines, so these are potent vasodilating medicines that we can give directly to the penis. There are things called vacuum erection devices that can help augment blood flow to the penis. But some men just aren't able to achieve a good natural sex life with those measures, and so that's when we would proceed to surgical options. So this is going to be a smaller percentage of men that end up needing a penile prosthesis, for example. These are devices that would fill with saline and provide a hard, usable erection that is very similar to what a natural erection would be. I think we have great treatments for erectile dysfunction that help most men, but unfortunately there's no cure at this time for erectile dysfunction. That said, there is some great research ongoing right now for new treatments to try to treat and hopefully cure erectile dysfunction. This includes things like shockwave therapy to help induce new blood flow and new vascular growth in the penis. Hopefully over time this research will prove fruitful in trying to cure erectile dysfunction. We are a specialty clinic of board-certified urologists. We don't just look at one aspect of a man's health, but we really try to look at the comprehensive health of a male. If you have questions regarding men's health, sexual issues, or even general urologic issues, please call our office for a consultation.